Welcome, everybody. It's Janette Yee, perinatal athletic therapist, and today's topic is the C-section shelf. What causes it and what we can do about it. So, friends, here's what I want to do. I want to ensure that everybody here understands that the C-section shelf is, it's not a term that's official. There's no medical term to describe the appearance of one's abdominals after major abdominal surgery. And when I say major abdominal surgery, I'm not just talking about C-sections or cesarean births. I'm actually talking about things like hysterectomies. I'm talking about myomectomies, which are fibroid removals. I'm talking about DIEP flap surgeries, which is reconstruction of breast tissue using abdominal fat. There are so many types of abdominal surgeries where the appearance of your abdominals after surgery, where it looks like it's looks like a shelf. It's like there's a larger top area, an indented area, and possibly a lower, larger area as well, a bulging area. And that is super common. So I really wanted to talk about that today because so many people going into C-sections and other abdominal surgeries, they don't know that that's a thing. No one told them that their appearance would be the way it was. So for the folks who are here right now, can you just give me a bunch of hearts? I see a lot of people on TikTok, a lot of people on Instagram here. Give me a bunch of hearts if you were like, after your major abdominal surgery, you were like, oh my gosh, I did not know this is what it was going to look like. Thank you. Instagram's like, yeah, that was me. I see a couple people just signing up now. Mimi Doll 23 is just logging in. Amy Color just dropped in here. So write in the comments, what was your first reaction when you looked down at your fresh abdominal surgery? Okay, I've got some googly eyes, like shocked faces and the emojis here in on TikTok. Give me a bunch of, tell me in the comments. Instagram, tell me in the comments. What was the first thought that came to mind when you looked at your own abdominals after surgery? Like when you took off the bandages and you finally had a look. Let's see. Oh, Judith C. Weber is just telling us that has had her second and third cesarean. Yeah, okay. Here's a response from Instagram. How do I get back to normal? This isn't me. Danielle saying, horrific. What have I done? Another response. Is this going to be permanent? Princess Di says, I felt so down. 3 C-sections. Hey, Early Left says, how do I make this look normal? Let me just read a couple from TikTok up here. I was scared. I thought my scar was so big, right? I was scared. Yeah. Friends, so I want to acknowledge all of these feelings because in my opinion, I mean, I'm not someone who's frontline. I don't perform the cesarean birth surgery, but I do the rehabilitation for the cesarean birth surgery. And what I am often met with are women who are just so overwhelmed and upset because no one told them. So I know I'm preaching to the choir here because if you're following me already on TikTok and Instagram, you already know that on my platforms, I try to show as many real bodies, real scars as possible. And this is not meant to frighten you. This is meant for you to understand that the same surgery looks different on different bodies, and that's okay. And if you haven't had your C-section or cesarean birth yet, you may or may not look like some of these scars that you see in my platforms. All right. But they're meant to empower you so that the first scar that you see isn't the one on your own body. Okay. Can we just get a thumbs up here so you all understand that the purpose of my accounts here is to empower. All right. Okay. If you're joining me for C-section shelf, the title is C-section shelf is normal in the early days. We're going to talk about why, and we're going to talk about what we can do about it. Okay. And if you are specifically between 0 and 3 months postpartum, this workshop is optimal for you. This is not to say that it's not useful for you if you're pregnant or 3 months plus. This is all. you got to meet yourself where you are. So if you've never done any rehab before on your body and you're like, ooh, I've got this appearance that isn't something I expected or necessarily want, I want to know if I can make this, if I can make an improvement, you may be able to. Okay. So the first thing is I want to know who you are. I know some people are typing in here, I'm 4 weeks postpartum. I'm logging in from the States here. I want to know who you are. So please take a moment and drop into the comments, Instagram and TikTok. Tell me how many weeks postpartum you are. Okay. And where you're from. So if you're pregnant, just tell me I'm pregnant. I'm 36 weeks pregnant. Or if you're postpartum, obviously how many weeks. You've got Sarah here who's 4 weeks postpartum. Someone is having her first and is traumatized. Don't be traumatized, mama. If you are here, we are here to empower you and to educate. And with education, the overwhelm really, really, really decreases. TikTok is 5 weeks postpartum. I've got some here, 1.5 years from New York. Hello, Princess Di. Someone is 5 weeks post from, 3 weeks postpartum from South Africa, California. 13 days post, 13 days from your cesarean. So you're almost about to have your scheduled. I've got someone who's 2 weeks post from KY, Connecticut. Oh my gosh, I'm so sorry. I'm from Toronto and I never learned all my short forms for my states. I've got 6 weeks from Toronto, 6 weeks postpartum, 14 months postpartum, and pregnant again. We got someone from Utah, 4 months, and from California. Friends, amazing. So first of all, if you're just hopping on, we're talking about the C-section shelf and why it happens and what to do about it. TikTok, your goal here is you've got to follow me on Instagram, which is Ask Janette. It's the same account. And the reason why is because if you're going to miss part of this workshop, they're all saved on my Instagram. I can't save it on my TikTok. Okay. So TikTok, follow me on Ask Janette on Instagram. And Instagram, this is all recorded. So you all get to refer back to this. And most importantly, friends, please share this recording with your mom groups. Like copy this link and paste it into your mom Facebook groups in California, in New York, in Utah, in Toronto, all the places you just described, because this is public health, in my opinion. This should not be like secret information that if only you had all the money, like you could pay for it. Like this should be stuff you get at the hospital. So please, please, please work with me. Let's work together to elevate women's healthcare. Okay. Someone is from Indonesia. Someone's from Kenya. Join me on Instagram, copy that link of this workshop and copy it over to your Facebook groups and your mom accounts. All right. Every mom deserves a full postpartum recovery. That's why I come and do these workshops all the time. All right. So what is the C-section shelf? Obviously, you all signed up because you're like, yep, that's me. But let me just define as a therapist what I mean by it, because when I describe why it happens and what to do about it, it is only effective based on my personal definition of a C-section shelf. Okay, so let's take a moment and let's talk about this. So when you have any kind of surgery, but major abdominal surgery, when you cut through your skin and you cut through your fat, your muscle, all these layers, all the way down into your uterus, you cut the uterus as well. What ends up happening is you get a external scar, which is usually horizontal. I'm going to do this. You get an external scar, which heals tight, and the tissues above and below it bulge out past the actual scar. Okay. That's what I mean when I'm talking about the C-section shelf. Okay. I'm just going to do a little bit of a close-up here. So again, external scar, tight compared to tissues above and below, creating a shelf-like appearance. That's my personal definition of C-section shelf. Other therapists, other platforms may include other definitions, but this one is mine. Okay. So first of all, I know that there are people here who are not within the 0 to 3 months postpartum, and I want you to know that I have a resource for you. So please, if you are on my Instagram or TikTok, it doesn't matter, hop into the link in my profile. There is a free resource called C-section shelf, causes and what to do. So that is going to be applicable for you even if you're years postpartum. please hop over to the link in my bio and download that resource. Because you got to know the cause of your shelf before you can find a solution or strategy. Okay. Okay. So if you're 0 to 3 months, the cause, what is the actual shelf? Okay. So first of all, right after surgery, any surgery, but especially major abdominal surgery, there is major swelling, like major swelling. Anyone who's had a cesarean, just pop into the comments, like yes or a bunch of hearts. Did you experience a major swelling? Like, did you look down at your legs and you're like, oh my goodness, like my feet, I can't even get my sandals on, right? Give me a bunch of hearts. TikTok's like, yes, that was me. Yes, I'm getting some people. Yambuk is saying, yes. Bex is like, major swelling. Yes. And that's swelling, right? Same on Instagram. Everyone's like, yes, there is so much swelling. And it lasts longer than you imagine, right? You're like, whoa, what's happening here? 2 weeks later, you still can't get your shoes on, right? Like, we're talking weeks. So you're like, oh my goodness, is this going to be my new normal? Right? Bane Diaz is like, yes, that is me. All right. So first of all, I want to explain to you, here are the facts of why this C-section shelf happens. Number one is swelling. Swelling. You look at the swelling in your legs and your feet, that much swelling is happening in your abdomen. Remember pushing on your abdomen, not only did it hurt, but it was kind of like, it was hard but mushy at the same time. You know what I mean? It wasn't mushy in the sense of you're like, oh, I was just pregnant and now I should feel like a deflated balloon, like that kind of mushy. It feels hard mushy, right? Because there's swelling in there. There's swelling. So swelling causes, again, if I kind of describe that C-section shelf again. So here's my scar. I'm creating this kind of tight scar between my two fingers here, but the swelling is going to push out above and below. That's swelling. That's your number one cause of that C-section shelf. Okay. We're going to talk about what to do about this in a bit, but I want to talk about why the C-section shelf happens in the early days. So one is swelling. So if you're past, 4 months, 5 months, you probably don't have swelling anymore. Okay. So you're not going to need to deal with swelling, but if you're in the first 3 months, for sure, you're going to deal with swelling. Number two, scar tissue. So remember what I just showed you with my fingers? Between my two fingers, if you have a horizontal incision, it's going to look like this. It almost looks indented, right? Right? Like, think about when the staples, your stitches, the glue came off and the covering you look down, you're like, hey, it's not flat, right? It wasn't flat. Give me a bunch of hearts if this was you. You look down and you're like, whoa, this is not flat. It's actually dented in. Yeah? Right? Anybody? Give me a bunch of hearts if this was you, because I need to know that I'm speaking your language if this was happening to you. Okay, TikTok's like, yeah, that for sure happened to me. Okay, there's just a bit of a lag. Instagram's like, okay, that happened to me. So reason number two, why that was indented is because scar tissue heals tighter than the tissues around it. Okay, let me say that again. Scar tissue heals tighter than the tissues around it. So after your C-section, that's why you have that indentation, that valley, that dent in. Thank goodness the scar tissue heals tight, because you want to close down that open wound. Like, thank goodness we have super glue that our own bodies make. Okay, so let's just give a shout out to scar tissue for a second. It was like, thank you, body. Thank you. And don't forget, you don't have just that external incision. You've got a vertical one down your linea alba. So that's got scar tissue that pulls it together. Okay. And then on your uterus, deep, deep inside your body, there's another big incision, and that's glued together with scar tissue too. So there's a whole bunch of stuff that's tight, and that's why it makes you feel like, oh, I'm bent forwards, right? Right. So that's reason number two. Folks, if you're just joining me, we're about to talk about the third reason as to why the C-section shelf happens in the first 3 months. If you missed the first bit, don't worry, it's all being recorded here on Instagram. So just make sure you watch this after I'm done. TikTok, you're out of luck unless you follow me on Instagram. Okay. That way you can watch the beginning of this workshop. And my Instagram handle is the same as my TikTok. It's Ask Janette. Ask Janette. Astrid is asking, can it be healed after 13 years? So Astrid, you're just hopping on now. I wanted to let you know if it absolutely things can change even years later. But Astrid, it's important to know the cause of your particular abdominal appearance. So I have a free resource in the link in my bio, Astrid. If you go there right now, the free resource is called C-section Shelf, Causes and What to Do. And at 13 years, you don't have swelling anymore, but that scar tissue can be tight, but it could also be a whole bunch of other stuff. There's actually more, like I can think of 9 reasons off the top of my head why a C-section shelf happens after the 3-month mark. So Astrid, it's important for you to know why, okay? So that's for Astrid and anybody else who's outside of the swelling time frame, which is pretty much past 3 or 4 months postpartum. Okay, so the third reason after your C-section, why the C-section shelf appearance happens is stretched muscles. Stretched muscles and stretched skin. Like let's face it, you spent 9 months stretching out to accommodate a growing baby. And when that baby suddenly comes out of you, it's not like your body suddenly just like, oh, I'm unpregnant. I don't need to be this stretched out and loose anymore. No, it takes a while. It takes a while. And sometimes things stay stretched too, and that's okay. But the muscles I really want to highlight, my friends. So again, if we go back to my definition of C-section shelf, you got tight scar tissue between the fingertips here, but you've got a bulge above and below. That bulge is caused by swelling and by weak and loose muscles. They're just gonna hang, and that's okay. So I don't know if these 3 reasons are news to you, because I think in the hospital, this is like standard information that every person should know. Because then you'd be like, that's why I hurt so much. Yes, I understand why I should take a rest. Okay, I see why I need to be doing some rehabilitation about this. It's not just gonna heal itself, right? It would empower you. Yeah, I got some TikTok people here agreeing. Thank you, TikTok folks. Okay, so now what I really want to bring home here. Oh, I've got a comment from Hell on Heels. They don't talk about you at all, only the baby. You know, that is 99% of the time true. Yeah, we've got some amazing healthcare providers who go above and beyond outside of what is needed on that checklist of things that happens in the hospital. And they go, hey, mama, how are you doing? You know, what can I do for you? How are you feeling? But outside of that, you know, oftentimes healthcare providers only have the time to do the bare minimum, and they've got this massive checklist they got to get through. So you're right. It's very much focused on baby care and not as much on pregnant person care, like mom care. Mom's the vessel that like housed the baby, grew the baby, needs the rehabilitation, is kind of hurting. So, but this is not the workshop to discuss how we can overhaul North American healthcare. Trust me, I've got opinions. But let's go back to the C-section shelf. So the take-home message from the 3 major causes of the early C-section shelf, what I really want you to understand is, friends, it's completely normal. This appearance on your body, this early C-section shelf, is completely normal. In other words, this is nothing that you did to cause it, meaning there is nothing you could have done to prevent it, meaning this is okay. This is okay. Do not be afraid. It happens to everybody. Okay. You are not an outlier. Okay. Nothing is wrong with you. So that's the first thing I want you to know. The second thing I want you to know is you might want to do some rehab on it. Okay. Because that appearance is temporary, but it can also be more permanent than temporary if you don't do anything about it. And I'm not, again, not trying to fearmonger, but what if You just did simple things. I said, like today's workshop, I'll give you 3 simple tips. You did them and it would make a world of difference. Would you do them? Would you do them? And it cost you like no money, just time, just thought. Would you do them? Right? Thank you. I'm getting a bunch of yes on TikTok. Yes. Right? Thumbs up, says TikTok. For sure. Bunch of hearts. For sure, says Instagram. So that's what I'm here to do. So as a perinatal therapist, I want to tell you the bare minimum stuff that's going to make a massive difference. By the way, my background is working with elite athletes, specifically women's rugby. There are some bad-ass injuries that I've seen in my time. And it doesn't matter what injury it is. If you control the swelling from the first moment, that athlete has a much better chance to heal faster and heal better. So that's exactly what I want you to know. For those moms who are booked or tuning in right now and you are still pregnant, this is the best time to do this workshop because you're going to be all dialed in and ready to go. You're like, I know how to control my swelling. I've got all my compression gear ready to go. But it's not too late if you are still 0 to 6 weeks postpartum. Let's talk about tip number 1. Okay. So tip number 1. Remember I said the first cause of this early C-section shelf is swelling. Yeah? What would you do to control the swelling? Pop it in the comments. Anybody. What would you do? And some of you might have already done it, right? But going back to your athlete days, you sprain your ankle, it's blowing up. What do you do for it? Swelling. Tell me. Let me see comments. Ha ha ha. Jazz is like, compression. Oh yeah, TikTok knows compression. Okay, someone else said ice. For sure ice. For sure ice. But walking is helpful, but that wouldn't be your first thing. So it's acutely swelling. It's like even it's swelling. Another word for swelling is just like it's bleeding, but internally. So let's say you're having like an open bleed. It's bleeding everywhere. What's the first thing you would do? Catherine is yelling, compression. Yes, compression. Laura's like compression, compression. You compress it. P.S. The literature shows that compression is more effective than ice. Okay, so if you can't get ice, you're like sprain your finger, you sprain your ankle, your kid sprains their whatever, you can't get ice on it, just like compress it, squeeze it, tie a sock around it. Helps a lot more than the ice. So it's the same for your C-section shelf. Compression. Now, I could run a 30-minute, 40-minute, 50-minute workshop just on compression alone. But I'm not going to do that today because I want to get through 3 tips. But compression can happen in a few ways. So number 1, I wore my high-waisted underwear to show y'all. So if you already have some high-waisted underwear, can you put it on, please? Right? Because and look, this is not particularly tight. So it's not the best compression. However, it is better than low-waisted underwear because low-waisted underwear compresses below your scar, but leaves everything above the scar not compressed, and it pushes the swelling there. In other words, it accentuates your C-section shelf. Yeah, what isn't compressed, that's where the swelling goes. Swelling goes where the compression isn't. Is that an aha moment for anybody here? Right? Yeah, okay. TikTok's like, what? I didn't even know that. So that's why, please put on your high-waisted underwear if you already have them. And when I say high-waisted, I mean above the belly button. Because don't forget, you've got a vertical incision after your cesarean. You just can't see it. But you got to compress past the end of that vertical incision. So above belly button, please. Right? Helen Heel says, oh yeah, it makes sense. Early Let is like, I would love recommendations for compression. Okay. So again, not going to get tons into it, but let me tell you about what I would absolutely recommend. So first, leaving the hospital for all my American sisters, I hear that at the hospital, you are gifted with an ab wrap. Here in Canada, we aren't. We don't leave with an ab wrap. But if you can have an ab wrap around your body, please put it on gently. Okay, more compression is not better. When you put it on correctly, pain decreases. And you may be shocked at how little compression you actually need to decrease the pain. And when I say pain, I mean pain everywhere, not just in a surgical area. I mean your back, your hips, your everything, your legs, everything. Okay, so Gentle compression starting day one. Now, as the compression decreases, going back to early let's question here, what would I recommend? Compression pants, like a compression garment. Now, I know I'm holding up a pair of pants that looks like it's very small. This is size 2, an unpregnant Janette. So, and even then, it's super tight on me. So this is a sample. This is not like, you should all squeeze into this. No. SRC Health, I'm just going to zoom in here so you can see the actual logo. SRC Health is a fabulous Australian line that I recommend to all of my clients. Every single one of my moms get this or recommended to get this. It is something that compresses all the way up from pubic bone to the top of your ab muscles, which is your sternum, the whole thing. And this is gentle compression that you can wear 24/7. You can sleep in it. And yes, it should be comfortable to sleep with. There is a pelvic floor support, and this is not something that happens in all compression garments. Okay, so if you are interested in this particular garment, I have a link again in my bio for a 15% off discount. So you can feel free to grab that if you want. There's so many questions about compression. Let's see, Clara says, my hospital gave me a belly binder a day after and told me to use it as long as I'm comfortable, just not too tight. Exactly. Perfect. That's amazing, Clara. I'm glad you got one. My incision is really low, says Steph. So it's hard to sit with a compression binder. Yeah, it's true. You know what? Oh my gosh. Who would be interested in a full compression workshop? Because today is not it. Give me a bunch of hearts if you're like, yeah, I want to know all about compression. I want to know when, I don't want to know what, I want to know how am I doing it right, how to progress wearing this, like when to wean myself off, how to wean myself off, like the best models, like how to buy one. Okay. Oh my gosh, I think this is the highest response so far. All right, friends. Okay. I'm ready. I'm writing it down. Oh my gosh. Okay. So compression workshop. Okay. You have spoken. Yep, I want to do it, but I can't find a comfortable method or strength. I know 3 weeks too late to start compression. No, Tanika, it's not too late at all. Absolutely, you can start, especially after cesarean. It's surgery for sure. It's going to help with the shelf. So let's go back to the first part of what we're talking about. So yes, we're going to do a compression workshop sometime soon, but let's talk about tip number 2. So remember, if you're just joining me now, I'm Janette Yee. I'm a perinatal therapist, and today we're talking about the C-section shelf, why it's happening, and what we can do about it in the early days, okay, in the first 3 months. And if you missed the first half of this workshop, don't worry, it's being recorded on my Instagram. So TikTok, you're out of luck unless you follow me on Instagram. Okay, so make sure, follow me. Ask Janette is my Instagram, and you can check out that replay. And mamas, please help me elevate women's healthcare. I am here every Monday, but I need your help. So link this recording, this Instagram recording, to your mom groups. Share it with every mom. This should not be private and secret information. Every person who's had a C-section deserves to know how to care for themselves. Link it to your Facebook groups, send it to at least 2-3 of your friends. Like, please help me help as many moms as possible. Okay. All right. Tip number 2. So tip number 1 was compression, high-waisted underwear. Tip number 2 is, remember, cause number 2 of the C-section shelf is tight scar tissue. Again, if I'm pulling, pretend there's a scar between my 2 fingers, see how it's tight and indented? That's because it's scar tissue. It's designed to heal tight. It has to heal tight. So what is the solution for a tight scar? What do you think? Put it in the comments. I'm looking. I know some of you know the answer because some of you do work with me. Some of you have done some of my programs. So some of you know what the answer is for a tight scar. What's the answer? Tell me, TikTok. If you have a tight scar, other than compression, how can you make it looser? How can you make it move more? Oh, Chewy guessed right. She's like, massage? Yeah, you're right. Oh my gosh, so many people throwing in here. Massage. You got it. Now, I'm not even going to ask how many people were told about massage by their obstetricians and midwives, because actually I know a couple of midwives who are now telling their pregnant folks to consider massage, especially after cesarean, because a lot of people don't think they're going to get a cesarean, but 1/3 of all pregnancies result in cesarean. Anyways, so massage, scar massage is the answer. So one of the biggest ways you can improve the appearance of your C-section shelf is scar massage. Now, please, friends, I don't want you to hear that, oh, Janette is really focused on vanity. She only cares about what the scar looks like. She's not a therapist. Let me tell you something. What your healing looks like is every therapist's business. Why? Because it gives us a huge clue as to how well you're healing and maybe how well you're not healing. For example, if you came to me at 3 weeks, let me correct myself, at 6 weeks postpartum and your scar looked like this, it was tight and indented, I would say that's normal, right? Because you haven't done any scar massage, your doctor just discharged you and you haven't touched it. So I'd say that's normal. But if you came to me at 8 months postpartum and your scar looked like this, the swelling was gone, but the scar looked like this, I would tell you that's not normal. I say, no, there's stuff you need to do about that to make sure that you're not going to have constant pain, that you are going to be able to strengthen your abdominals properly, that you're not going to have painful sex, that you're not going to have increased risk of injury when you're returning to sport. You probably already returned to exercise and your hips hurt and your back hurts and you don't know why. So the appearance of your scar is very important to me as your therapist. It absolutely matters. And it should matter to you too. Please don't let anyone shame you into thinking that, oh, I have this appearance and I want to change it. It is not a vanity thing. It is a healing thing. It's a recovery thing. Let me empower you for a moment here. It is okay to want this to look better because it is part of healing. So scar massage is the thing. Now, scar massage is an actual progression. It's a program. Yeah. So if we were to work together, I wouldn't give you a book. I'd give you like a printout. I don't have my little printout with me, but it'd be a 4-page printout. You print it out and it would list every single scar massage you got to do. Okay. That's in the first 6 weeks, the first bunch of scar massages you got to do. And then it'll show you how to progress it. So for example, one of the first scar massages you would do before your doctor even discharges you is something called desensitization. You're going to just lightly tap, 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 tap your surgical area, right? This is all skin deep only. And this really helps with numbness. It really helps your skin learn to feel again. Is it going to help with that indentation? No, but when you're finally discharged by your doctor and your doctor says, hey, Jenny, you don't have an infection. Go ahead and do anything you want now. It's healed well. You will not be touching it for the first time at 6 weeks postpartum. You'll be ready to touch it a little more intentionally. You won't be afraid to mobilize that scar. You won't be, so, oh my gosh, for real? When I say to you, hey, I need you to go deeper. I need you to go harder. I want you to pull in this direction. Does that make sense? Farhana's asking, my C-section scar has lumps. I think it's keloids. Can I do scar massage to help this a year later? Farhana, if it's keloids, scar massage may not help. In my experience, it may not help. If your keloids are itchy, definitely see your doctor because injections can really help decrease that itch. But I use a scar tape. I use an incredible scar tape. And I'm still in the works of trying to figure out what provider can provide us with a really great scar tape. Is a brand I'm working with right now because I did absolutely rep a brand last year, but they decided to stop carrying the scar tape. So scar tapes are not all created equal, but there's one specifically for all scars, but absolutely including keloids that would be helpful. So for Hana, scar massage is probably not going to be helpful, but at 1 year, it's going to help move it. It's going to keep it from being stuck to other things deep to it. And that can also be causing pain. All right. My scar is numb 2 years later, says Helen Heals. this tapping will still be helpful. Hell on Heels, do this now. Do it now. Do it all the time. Do things like scratching, raking, tapping, poking. In my program, I even talk about, I mean, this is not a fork, but if you take the pokey end, the tines of a fork, if you rake a section of your abdominals that never had a surgery compared to the section that did, it's amazing how different it can feel. But you want it to feel similar by the time you're done. And it may just take a couple of weeks of doing this. Okay, so see if that's helpful. But the point is this, scar massage is the thing. You absolutely want to do it. And it's not hard. Trust me. I have helped thousands of C-sections, cesarean birth moms around the world just with print off this program and here's the video, and they can do it. You don't have to be a therapist to do this. It's just literally through my program. That's all. I physically touch a handful of clients in person. Of course, in-person massage is way more impactful for seeing someone in person, but if you can't see someone in person, 5 minutes a day of scar massage yourself, I can't even explain to you. C-section shelf, literally, that tight scar literally can be highly eliminated or like gone altogether. Okay, so please, 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 scar massage, do it, do it. I recently had my 4th C-section about 5 weeks ago. My C-section shelf is really severe. Is there any hope? I just joined as live, so I haven't seen what the others are saying. That's okay. If you're just joining, this entire thing is being recorded. So you're here on Instagram, it's recorded on Instagram. But TikTok, if you're just joining, you've missed the first half and it's not recorded on TikTok. So you're going to have to follow me on Instagram, which is Ask Janette, to get the whole recording, okay? So don't worry, mama, I got you. And if at any point you have a question and I'm not answering it, just send me a direct message on Instagram. TikTok, I don't really check my direct messages there. So please follow me on Instagram. I've got my whole team helping to answer a lot of questions there. Okay, so scar massage. How do you do scar massage? You learn it through a program. You don't have a program? Consider doing mine. It's linked in my bio. Don't even think about it. Like, you've got to do a rehab program. Your scar massage will help tremendously with just 5 minutes a day. I'm not even trying to sell you something that won't work. It's just something that I think is standard of care. Lastly, the third and last point about what causes a C-section shelf is this. So remember, first is swelling, right? So swelling pushes out above and below. Number 2 is a tight scar, and that's why we do scar massage. And number 3 is loose muscles, which also kind of sag up above and below. So loose muscles, what do we do about loose muscles? Pop it in the comment. What is the solution for loose muscles? You've been stretched for 9 months. Even if you were exercising throughout your 9 months, what do we do with loose muscles? Pop it in the comments, please, TikTok and Instagram. Because here's the thing, you might not know this, but you also have a diastasis. And C-section moms, that diastasis was cut right through during your surgery. Now, this, again, isn't meant to scare you. It's meant to be educational so you understand how important it is to do mom of 3 girls with twin boys, PT. And if you're talking about rehabilitation, absolutely. Rehabilitative exercises. Belly breathing is an example of, of rehab exercises. So you want to do your diastasis exercises. Breathing is part of it. I call it the ABCs. A stands for alignment because your posture is completely changed after you're pregnant. B is breathing. So a lot of moms have dropped in here breathing exercises. Yes, because you want to be comfortable breathing in and out of your belly, but also to learn how to keep that set while you breathe in and out of here. Okay. And then C of ABCs refers to core control. Yes, that is your diastasis rehabilitation, but it's also C-section or cesarean rehabilitation. Do not do this. You must do your basic strengthening exercises. It'll make such a world of difference of the appearance of your C-section shelf if you are concerned with it. And here's the cool thing, re-strengthening never too late to start. So I know there are a lot of folks here who are like years postpartum, like, Janette, what can I do about this? Well, if one of the causes of your C-section shelf is loose muscles, you can always retrain them. And the ABCs method is included in my cesarean recovery program. It's included. So you're not only rehabilitating the muscles, but you're also learning how to massage the scar. So please, if you haven't done any rehabilitation, take a look at my rehabilitation program. It's linked in my bio. If you're early recovery, which is right now, I highly recommend you enroll for the year because it does take 6 to 12 months to heal from major abdominal surgery, depending on, how much rehab you can do a day. And by the way, it's 5 minutes a day. But what you do in those 5 minutes changes as you heal. And it changes as quickly as every week if you're able to do it every day. Okay, so I know I have a couple of questions here. Twin moms of 3 girls and twin boys, are these the same techniques that you need if I'm getting a hysterectomy with a C-section incision? Fast answer, 100%. I feel like my muscles aren't engaging now. I can only imagine it's going to get worse. So mom of 3 girls, and to anybody who is about to enter into any kind of abdominal surgery, including C-section, reframe it. This is an opportunity. You get to rehab the right way this time. It's never too late. You get to do it right this time. So if you're pregnant, enroll in that program now because you want to learn the ABCs, the rehab exercises now because you can do them starting day 1. Learning to breathe is day 1 exercise. Swelling control is a day 1 technique, right? Learning proper posture is a day 1 exercise. So mom of 3 girls and twin boys, if you can, hit the ground running and enroll in that program right now. It's linked in my bio. It's called Cesarean Recovery Foundations and enroll for the year. Now, some of you are like, I don't know if I need a whole year because I'm like already 4, 5, 6 months postpartum. That's okay. Just enroll for the month, right? That's $69. By the way, all my friends here in Canada, if you have athletic therapy coverage, my program's covered by your athletic therapy benefits. It's free. So do your recovery. It makes such a massive difference in your C-section shelf. Friends, thank you so very much for listening. And please, if you have any questions, send me a direct message or a DM in Instagram. TikTok, please follow me on Instagram because I do follow up and answer people in Instagram, but I don't have the manpower to do so in TikTok. But I thank you all so much for joining me. This workshop is saved and recorded on Instagram. I will see you on Monday with another topic. Okay? Thank you so much, folks. Take care.